I've always wanted to help people, even when I was a little kid.
Roberto Calderon is a paramedic for the Florida Keys ambulance. He and his co-workers, he said, are no strangers to violent confrontations. While Calderon says he doesn't always handle violent patients, however, healthcare specialists across the country, such as nurses, technicians, and physicians, face physical and verbal abuse by patients almost every day.
I was choked by a patient. It was an overdose patient that was, had been given the Marchante and woken up, and then he became violent and kind of everyone scattered, but he grabbed me by the throat, and, luckily one of the big x-ray techs came in behind him in a chokehold, but that was the only way he let go of my throat, and I had all the bruises and the broken blood vessels in my eyes, and my necklace got ripped off. That was the last time I wore jewelry to a shift.
And the assaults aren't lessening, with emergency departments seeing an increase in violence in the past 5 years, according to a recent survey that was presented at the 2018 American College of Emergency Physicians Conference in October. Polling more than 3,500 emergency physicians across the nation, the survey found that nearly half of emergency physicians have been physically assaulted at work. Over 70% of those polled also reported witnessing another assault. 6 in 10 of those assaulted say it's occurred in this past year alone. The survey also reports that almost all assaults were committed by the patient. 28% of assaults were committed by a family member or friend of the patient. These results aren't surprising for Dr. Robert Levine, the chair of emergency medicine and critical care at Florida International University.
There's almost no one in emergency medicine that hasn't been threatened, physically, verbally abused, or actually struck and actually physically attacked in the emergency department. Nurses take a huge brunt of it, but most physicians have also been threatened, if not actually attacked.
The Occupational Safety and Health Administration drew attention to the increased violence a few years ago after the Bureau of Labor Statistics reported that private hospital workers were more likely to be injured on the job compared to other fields. This then prompted the Florida Hospital Association to create their We Have Your Back initiative to improve the workplace condition for both workers and patients.
It is a sharing of best practices. So in that, those educational events and seminars, we featured, there's also webinars, we featured best practice examples from other hospitals. It's not information that's coming from FHA. What we do is we promote what our members are doing that are best practices.
Wilgers and Levine both agree that hospitals have improved their policies and safety measures over the past few years, but support, one psychologist says, needs to reach outside of the hospital as well.
Part of having a high-stress job is also having some really strong support systems. So we can't just rely on one person. So whether it's a partner or one best friend, we need to sort of share the wealth.
Despite the risks, Calderon said it won't stop him from doing what he loves.
There's always a risk. You could always die, and that's basically in any field, but the reward is so much more.
While the survey doesn't explain why the violence has increased, Vincourt, Levine, and Calderon do believe the rise of drug usage, such as opioid, is part of the problem. The solution, according to Vincourt and Levine, range from increasing hospital security to legislative changes. Reporting for FIU, this is Michelle Marchante.